Hello dear students. So after a long time I have again started my YouTube channel so that I can help you in preparation of competitive examinations, that is AIMS, ESIC, JIPMER, PGI Chandigarh, okay, and even CHO. So in view of that I have started again video classes so that I can help you in preparing the competitive examination. So today I am going to begin with the medical terminologies, which is very important. So first I begin with the medical terminology. So don't consider it as a simple topic because it is a basic. If you know this one, you can understand better the medical surgical nursing. So you will start with the medical terminology. So first one is ostomy. Ostomy means it is a surgical opening. Okay. So surgeon will make opening on the patient body, but wound keeping wound opened as it is. Surgeon will not close the wound here. So surgeon may open the wound. Okay, he may take incision on the patient body, but he keeps the wound as it is, as open it is. Okay, he does not close the wound. So this type of terminology suffix we will know as a ostomy. I will tell you the example. For example, colostomy. So you may see in the patients there is a colostomy, means surgical opening of colon and keeping the colon open as it is. So this kind of terminology suffix will have a ostomy. Okay, colostomy, ileostomy. You can see jejunectomy. So these are the this is the terminology of ostomy. Okay, so I have all of you understood this terminology. So next terminology we will see otomy. In this otomy, the surgeon will take opening. Okay, so this is if you take an abdomen, surgeon will take incision on the patient body. Okay, so after that he will close the wound. Once the opening of once the incision is taken and once the whatever the deformity or problem that is happened in the body, so once that is corrected, the surgeon will close that wound immediately with the sutures. Okay, you can see there is a closure of wound with the sutures. So that is known as otomy. Okay, so otomy is nothing but a surgical opening and then closing it immediately once the purpose of surgery is served. Okay, so it is a surgical opening on the body and closing it immediately once the purpose of surgery is done. Okay, so this is known as otomy. Okay, so I may give you example of otomy. So you can see this is a suffix of this otomy suffix. You can see like a what you can say sternotomy. Okay, I am giving you example sternotomy. So sternotomy means surgical opening of sternum, and once they open the sternum, they will see what is happen inside the sternum, and then once that is corrected, they will close it immediately after the purpose of opening is done. Then laparotomy is surgical opening of abdomen. Okay, and sorry, laparotomy, you can say craniotomy. Okay, so all these suffix like otomy is coming here. So this indicates that it is a surgical opening and then closing it immediately once the purpose of surgery is done. Okay, so this is a otomy. So next terminology you can see here, that is ectomy. So ectomy is nothing but what? Surgical removal of body parts. Okay, surgical removal of body parts. Okay, so the body parts which is not functioning, which is hyper functioning, or which is hyper functioning, or which is not at all functioning at all in the body, so that part is surgically removed. Okay, so that suffix is ended with the ectomy. You can see example of appendicectomy. appendicectomy. So you can see here sectomy. Last you can see here ectomy. So that is nothing but a surgical removal of vermiform appendix. Okay. Hysterectomy. Hysterectomy is a surgical removal of uterus. So all the terminology which is ended suffix, that is the suffix of them is ectomy. So that indicate that surgical removal of the body parts. Okay. So I hope you understood this ectomy, otomy, ostomy and ectomy. Okay. So all of these three terminology sounds similar, but they are not, their meaning is very different. Okay. So that you have to keep in your mind. So next suffix I will tell you itis. Itis is, what does itis indicates? Itis indicates inflammation. Okay, the suffix itis indicates inflammation. Okay, so what does it indicates? It indicates inflammation. Okay, so there is a inflammation in the body parts, so that terminology is end up with the itis suffix. Okay, so for example I will tell you gastritis. Gastritis is nothing but a inflammation of stomach. Okay, so see here itis, so this itis indicates inflammation, and this gastro it related to stomach. Okay, so gastritis is nothing but a inflammation of stomach. Okay, next example we can see here glossitis. Glossitis is nothing but a inflammation of tongue. Okay, so all these the terminologies which end up with the itis suffix, so that indicate that there is somewhere inflammation in the body parts, and it indicates the inflammation. Okay, so it may be glossitis, tonsillitis, pharyngitis. Okay, so glossitis means inflammation of tongue, pharyngitis inflammation of pharynx. Okay, so all this itis is an indication of inflammation. Next one is tachycardia. Tachycardia is when patient heart rate increase more than, okay, when heart rate indicates more than 100 per minute, it indicates tachycardia. Okay, so once if the patient heart rate increase more than 100, it is known as a tachycardia. Okay, and opposite of tachycardia is a bradycardia. So suppose patient heart rate decreases. Okay, if the heart rate decreases less than 60 per minute, if patient heart rate goes below 60 per minute, it indicates that bradycardia. Okay, so the terminology for increased heart rate more than 100 per minute, it is a tachycardia, and the terminology for decreased heart rate less than 60 per minute, it is known as a bradycardia. So in examination they may give the statement and may ask which is the terminology for that statement. Okay, and next one we can see here hematuria. Okay, next one is a hematuria. So hematuria means it is a presence of blood in the urine. Okay, so when you see there is a presence of blood in the urine, when we do urine microscopy, okay, we will see there is whether there is any presence of red blood cells or any blood cells in the urine. So if there is a presence of blood cells like RBC in the urine, that indicates that hematuria. Okay, so the urine color may also change it into cola color, like so that indicates that hematuria. Okay, so you need not to know what is the reason for all those things. Only we are now discussing about the medical terminology. You need to know only the meaning of the terminology. So when we study the disease condition, we can understand the what is the reason or underlying cause of this terminology. Okay, next we will see pyuria. Okay, pyuria means presence of pus in the urine. Presence of pus in the urine. So whenever you see there is a presence of pus in the urine, okay, so that indicate that pyuria. Okay, so how we can know the presence of pus? It is only possible by urine microscopy. Okay, when we do urine routine, so when urine is examined under the microscopy, if we see there is a presence of pus in the under the microscope, that indicate that the patient is having a pyuria. Next one is Oliguria. Oliguria is nothing but a urine production decrease less than 400 ml per day. Okay, so urine production when it decreases less than 400 per day, that indicate that a oliguria. Okay, so urine production less than, okay, so urine production less than 400 ml per day. Okay, so normally the patient urinate 1.5 liter to 1.75 liter per day. Okay, 1.75 liter, okay, 1.75 liter per day. But here what happened, the patient urine production will be less than 400 ml per day. Okay, so whenever a patient with a urine production less than 400 ml per day, it is known as oliguria. Okay, so this condition you can see in case of there is a renal failure. Whenever there is a kidney failure, you can see there is a decreased urine production per day. Okay, next one is anuria. Anuria means there is a absence of production of urine. Okay, there is absence of production of urine. Okay, so when this is a terminology for anuria. Okay, so absence of production of urine, there is a complete absence, stoppage of production of urine. Okay, this happens in the end stage renal disease. Okay, ESRD, end stage renal disease, where there is no functioning of nephrons of the kidney and there is no proper production of or formation of urine. So in that condition you can see there is a absence of production of urine. Okay, there is no production of urine at all. Next one you can see here, that is dysuria. Dysuria means difficulty in urine, difficulty in urination. Okay, the patient may face very difficulty in urination. We can also call it as a painful urination. Okay, so this mainly happen in the benign prostate hyperplasia. Okay, when the neck of the urethra means neck of the bladder is completely obstructed because of hyperplasia of the prostate. Okay, so whenever the patient feel painful urination or there is a difficulty in urination, that is known as dysuria. Okay, next one is dyspnea. Dyspnea is nothing but a difficulty in breathing. Okay, difficulty in breathing. When patient have a difficulty in breathing, okay, so then it is known as dyspnea. Okay, we can see this dyspnea terminology more commonly in the respiratory disorders. Okay, obstructive respiratory disorders, functional respiratory disorders, all you can see that this is a common terminology in the respiratory disorder, dyspnea. Next one is orthopnea. Orthopnea means difficulty in breathing. Okay, difficulty in breathing. Okay, in lying position. Okay, means patient will have a difficulty in breathing in lying position. Okay, so whenever patient lie down, okay, whenever patient lie down on the bed, the patient will experiences difficulty in breathing. And as soon as the patient sits up, okay, in the bed, okay, as soon as patient sits up in the bed, okay, then what happens, the breathing difficulty will come down. Okay, so this is known as orthopnea. Orthopnea means difficulty in breathing in lying down position. Otherwise, when patient sit up, the difficulty in breathing will subsides. So difficulty in breathing in lying position is known as orthopnea. Next one is syncope. Syncope is nothing but a sudden loss of consciousness. So patient will loses his consciousness suddenly. Okay, so this happens in the case of neurotic disorders, where the patient will suddenly loses the consciousness, and the terminology for sudden loss of consciousness is syncope. Okay, now you don't think much about the, only you understand about the terminology. Okay? Only you understand the meaning of terminology, and later we can explain what are the underlying, what are the reason for these all terminologies. Next one is ataxia. Ataxia means impaired body balance and equilibrium. Impaired body balance and equilibrium. Okay, patient have a impairment in the body balance and equilibrium. Okay, there is no proper body balance. Patient will have a loss of body balance and equilibrium. Okay, usually the cerebellum part of the brain will maintain this body balance and equilibrium. So here the patient will have a impairment in the body balance and equilibrium. Okay, so what is that terminology for that one is ataxia. Okay, so whenever patient will have a impaired body balance and equilibrium, we will say medically it is a ataxia. Okay, next one is hemiplegia. Okay, so hemiplegia is nothing but a paralysis of half of body. Okay, paralysis of half of body means one side of the body is paralyzed. Okay, suppose the right hemisphere is not functioning properly, there is a left side of the body paralysis will be there, and if there is a left hemisphere is not functioning well, there is a right side of the body paralysis. Okay, why this opposite paralysis will take place means there is a crossing of nerves. Okay, so the nerves when they supply to the body, okay, after crossing into the neck, okay, so they will supply oppositely. Okay, the right cerebrum supply nerve to the left side of the body and left hemisphere supply the nerve to the right side of the body. So that is why you can see there is a loss of paralysis of the half of the body. Okay, paralysis of one side of the body is known as a what you can say hemiplegia. Next one is quadriplegia. Quadriplegia is nothing but a paralysis of all four extremities. Paralysis of all four extremities. Okay, see whenever there is a paralysis of all four limbs, extremity means all four limbs, upper limbs as well as lower limbs, so it is known as quadriplegia. Okay, this all happens in the case of stroke. Okay, hemorrhagic stroke and ischemic stroke. There are so many conditions are there means which can leads to paralysis. Okay, quadriplegia. Next one is photophobia. Photophobia is nothing but a fear of light. Okay, the patient develop anxiety or fear of light. Okay, whenever he exposed to the light, okay, he will have a fear or anxiety towards the light. So that is known as a photophobia. Okay, next terminology we'll see hypertension. Okay, hypertension. So hypertension is nothing but, see here, when we have two types of blood pressure, systolic blood pressure and diastolic blood pressure. Okay, so when normal systolic blood pressure is 120 and normal diastolic pressure is 80. Okay, mmHg, millimeter of mercury. Okay, so when systolic blood pressure goes beyond 140 and diastolic blood pressure goes beyond 90, okay, mm of Hg, okay, it is known as hypertension. But it is by one reading we cannot say that patient is a hypertensive. So if patient is persistently, if his reading is more than, systolic blood pressure is more than 140 and diastolic blood pressure is more than 90, so consistently for 3 to 5 days, then we can say that a patient is a hypertensive. So we cannot say that patient is hypertensive by one reading. Okay, so what is hypertension? Systolic blood pressure more than 140 and diastolic blood pressure is more than 90 mmHg. So if this reading comes, okay, it is known as hypertension. Next one is hypotension. Hypotension. So when the patient blood pressure, systolic blood pressure, okay, if it is less than 90 and diastolic blood pressure if it is less than 40 mmHg. Okay, see here, if the patient blood pressure is coming less than 90 by 40 mmHg, it is called as hypotension. Okay, if the patient blood pressure is less than systolic blood pressure is less than 90 mmHg and diastolic blood pressure is less than 40 mmHg. Okay, so if it is coming consistently this reading, okay, so we can say that patient is a hypotensive. Okay, it should come consistently for 3 to 4 days, 4 to 5 days. So consistently, if it is coming same reading, systolic is less than 90, diastolic is less than 40 mmHg, so it is a suggestive of hypotension. Okay, and next one is hematomas. So hematomas is nothing but a omitting of blood. So whenever patient omitting of blood, okay, so whenever patient omit the blood, it is known as hematomas. Okay, next one is hemoptysis. So hemoptysis is nothing but a presence of blood in the sputum. Presence of blood in the sputum. So when there is a presence of blood in the sputum, it is known as hemoptysis. Most commonly you can see it is in the tuberculosis. Okay, so presence of omitting of blood is known as hematomas, and presence of blood in the sputum is known as hemoptysis. Okay, next one is Malina. Malina is nothing but a presence of blood in the stool. Okay, so when there is a presence of blood in the stool, it is known as Malina. Okay, so this is happens only in case of GI bleed, okay, or any liver cirrhosis. Okay, Malina, presence of blood in the stool, it is known as a Malina. Okay, next one is cholelithiasis. Cholelithiasis is nothing but a formation of stone. Okay, formation of stone in the gallbladder. So you can see most commonly this cholelithiasis happens in the female fatty, okay, woman. So where you can see there is a formation of stone, okay, in the gallbladder, which is known as gallstone. Okay, so formation of stone in the gallbladder, it is known as a cholelithiasis. Okay, formation of stone in the gallbladder. Next terminology you can see here, diarrhea. Diarrhea is nothing but it is a passage of loose watery stool more than, okay, loose watery stool more than 3 times a day, more than 3 times in a day. Okay, so whenever patient comes with a complaint of loose stool, okay, loose passage of loose watery stool more than 3 times in a day, it is known as diarrhea. Okay, so what is diarrhea? Diarrhea is a passage of loose watery stool more than 3 times in a day. Okay, it is known as diarrhea. Okay, so all of you must know this terminology there, it is very important. Okay, next one is dysphagia. Okay, so dysphagia is nothing but a difficulty in swallowing. Okay, difficulty in swallowing. Patient is not able to swallow either food or water. Okay, so that condition is known as a dysphagia. Okay, the terminology for difficulty in swallowing is dysphagia. Okay, so these are all the terminology. Okay, so this is a medical terminology, it is a part 1. Okay, next the remaining medical terminology I will discuss in the next class. Okay, so I hope you understood all the meaning of the terminology. So if you like this video, please subscribe and share the video, and make sure you will subscribe and like the video. Okay, so thank you for watching my channel video. Thank you very much.